Renal calculi is also called urinary calculi, or simply called as urinary stone. The other term for this is nephrolithiasis. Nephro means nephrons which are present in the kidney. Lithio means stone. Iasis means many. Many stones in the kidney is called as nephrolithiasis. The stones in the urinary tract can be found anywhere in the urinary tract other than kidney as well. Like for example in the ureter of the kidney, which is a connecting fibromuscular tube between the kidney and the bladder, or in the bladder itself, that is urinary bladder, temporary storage organ for urine, or in the urethra. So it's also called urolithiasis. If it is not found in the kidney, if it is found elsewhere, we can call it urolithiasis. These stones, there are 5 types of stones in the kidney or the urinary tract, that can be in the ureter, urinary bladder, or urethra. That is calcium oxalate and calcium phosphate stone together can be clustered as calcium stones. Next, struvite stone, which resembles a stag horn, which is the horn of a deer, which has got multiple branching pattern. Then uric acid stone is made up of a waste product of nucleic acid metabolism called as uric acid, and cystine stones, which is a disorder of metabolic abnormality of amino acid cystine. One by one I'll tell you. So at the end of this you should be able to tell all the things related to stone. So first and foremost I would like to tell that stone formation occurs whenever the solute within the component, like for example here the solute is ions, the mineral ion like calcium ion, magnesium ion, phosphate ion, these are in excess, or the solvent is less. The solvent here is water. Majority of people won't drink enough amount of water. Normally we have to drink 3 to 4 liters of water per day so that all the solutes are dissolved properly and eliminated from the body. But if the water consumption is less than a liter every day, at the end of 2 to 3 years definitely we will have renal calculi or the urinary calculi, because the solvent is less. Imagine one glass of water you are taking and you are putting 10 spoons of salt or sugar. Do you think it will dissolve? I don't think so. So that's why we have to drink enough amount of water. By drinking water nobody will become obese. Okay, our body itself is made up of 65 to 75% water. So kindly consume enough amount of water if you don't want to get renal calculi or the urinary calculi. Moving on to the etiopathogenesis in detail, calcium salts like calcium oxalate, calcium phosphate, when does this stone occur? When there is excess calcium in the blood. When does the excess calcium present in the blood? When there is excessive exogenous consumption of calcium in the form of calcium rich food with inadequate intake of water, or excessive intake of vitamin D, or excess parathermone. Parathermone causes increased blood calcium level by causing increased absorption of calcium from GAT, increased absorption, reabsorption from the kidney, and increased resorption from the bone. So when it's causing increased blood calcium, this calcium concentration itself is high. So obviously when it's trying to get filtered, it will get stuck up in the kidney or the ureter, forming calcium stone. The calcium stones can also be due to inadequate water consumption. The most common type of stone in most of the individuals, are nearly 60 to 70% of the cases of urinary calculi, is calcium stone. We have so much of phosphate and oxalates available in the body to bind to the calcium. So the calcium stones are usually not just calcium ion, it is bound with phosphate. So it will be whitish in color, calcium phosphate, or oxalate, it's grayish white in color, calcium oxalate stones. These stones have got multiple spike-like projection, as you can see in the picture. It will obstruct in the pelvic calyceal system. This is about calcium stone. Moving on to the struvite stone. So struvite stone, it's a type of ammonia stone. Okay. So whenever a person has got repeated urinary tract infection, when they get repeated urinary tract infection, bacteria starts growing in the urinary tract, either in the ureter, urinary bladder, and urethra. These bacteria will produce waste product called as ammonia. This ammonia may combine with magnesium, calcium, and phosphate, forming a complex salt of magnesium ammonium phosphate or calcium ammonium phosphate. Okay, So these stones are called as struvite stone. So these struvite stones take the shape of the pelvic calcial system of the kidney, like this pelvic calcial system of the kidney. Here you can see yellow color. This projection in the yellow color is the pelvic calcial system, and the stone resembles the horn of a deer called as stag. So stag horn stones are struvite stones. These are frequently found in the patients who are having a repeated urinary tract infection. Moving on to the next type of stone called as uric acid stone. Uric acid is a waste product of nucleic acid metabolism. The nucleic acids are adenine, guanine, cytosine, uracil, thymine. They are present within the DNA or the nucleus of a cell. It can also come from the mRNA. When they are undergoing metabolism, these adenine, guanine, cytosine, uracil, thymine will become hypoxanthine. Hypoxanthine will become xanthine. Xanthine will become uric acid. All this happens with the help of an enzyme called as xanthine oxidase, which oxidizes the uric acid into hypoxanthine, then xanthine, then into a soluble form called uric acid. Normally, the amount of uric acid in the body is less than 1 milligram per deciliter. But whenever there is excessive metabolism, like for example a tumor, obviously more number of cells, more number of nucleus, and more amount of uric acid. Or tumor lysis syndrome, whenever the patient with tumor undergoes chemotherapy, a drug given to destroy the tumor, obviously it destroys more nuclear destruction, more uric acid. Or radiotherapy, radiation is given, x-rays are given, again same result will happen. Uric acid, when there is excess amount of uric acid and patient doesn't consume enough amount of water, when the uric acid level are more than 7 mg per dl, it's called hyperuricemia. These uric acid crystals are long birefringent crystals. It will deposit in the synovial membrane of first metatarsophalangeal joint of the great toe. So when the person is not able to wear the shoe or the chappal which they used to wear because the joint is swollen because of arthritis, suspect hyperuricemia or gouty arthritis. In addition to that, these patients may also have uric acid stones in the kidney. So that is about uric acid stone. And the last stone is cystine stone. Amino acids like cystine and cystine will undergo metabolism in the body to give rise to various byproducts. If this metabolic pathway is impaired due to an autosomal recessive inheritance where the cystine oxidase is deficient, that time the cystine will not be undergone metabolism, it will accumulate in the bloodstream, causing hypercystinemia. Same thing will eliminate in the urine, causing cystinuria. In these patients with cystinuria, the cystine amino acid crystals keeps on getting accumulated within the pelvic calcial system, resulting in a grayish white stone called as cystine stone. It's rare but possible. So all these stones, the calcium stones like calcium oxalate, calcium phosphate stone, the struvite stone, uric acid stone and cystine stone are common in the pelvic calcial system. So the stone of less than 5 mm can easily be eliminated by hydrotherapy or flush therapy. Hydrotherapy, we ask the patient to drink 5 to 10 liters of water per day if possible and give a diuretic. Then that will cause clearing of the stone if it's less than 5 mm. Or a patient who is not able to consume that much amount of water, will make them admit in the daycare and give them more amount of IV fluids and flush them with a higher efficacy diuretic like furosemide. That time also there will be flushing of the stone through the urethra, urinary bladder, urinary bladder and urethra. It's called flushing. So as the name suggests, it will clear out the stone if it is less than 5 mm. If it is a very large stone accumulating the entire pelvic calcial system like the staghorn stone, we have to do lithotripsy, wherein in the renal angle, the lateral border of erector spinae and the lower border of 12th rib, there the electrode which is highly vibrating is kept so that the stones are broken down, like the drilling machine breaks the stone in the mountain. Similar to that, here we are breaking on the pelvic calcial system of the patient. That is, procedure is called as lithotripsy. A very large stone which is not breaking even with lithotripsy, then pylotomy is required, that is excision from behind posterior aspect. We have to open up the renal angle area, open up the renal pelvis and remove the huge staghorn stone which is present over there. So that is about renal stone or renal calculi in detail. It's also called nephrolithiasis, urolithiasis, the 5 types of stone and the etiopathogenesis I have explained in detail. Thank you for watching and learning. Please like the video and share the video with your other friends, and don't forget to subscribe. Thank you.